So this video is the first of a series of videos educating and following a patient using PT straps for a deep peroneal nerve neurectomy. His surgery was October 1st, so he's basically 5 weeks post. And this is a great time. I'm looking at the incision, and this is all healed up. Barely even see it, but you can see there's a lump, and that lump is scar tissue. And if I move his foot, you can see the tissue pull right at the scar. And the patient feels, go ahead and point down. And what do you feel?
I feel like pain in my ankle, like below my ankle, like
right through here?
Yeah, right through there.
So we feel the pulling and discomfort right through here when you plantar flex. So our efforts with the PT straps is we're going to try to improve that over the next several weeks. So I'm going to measure the 4 directions, superior, inferior, medial, and lateral, by using a tape measure, okay? And I'm going to pull the tissue medially first to get an excursion. You can see when I pull, it is just doesn't move, okay? I would say 1/4 of a centimeter. That's it. I'll give the lateral 1/2 centimeter. Now we're going to do superior and inferior at the 10 centimeter. And I'm going to pull it superiorly. Not much at all. So this is one reason why when he plantar flexes, he feels it on the top of his foot. So I'm going to give that one, we'll say 1/2 centimeter. And then we're going to go inferiorly, and we'll say 1/2 centimeter as well. So pretty limited all 4 directions. The final direction is the lift. And here, on a scale from 1 to 3, with 3 being normal, 1 being tethered down. So when I lift, I can pinch it, but you can see the middle aspect is still staying down. If I compare it to the other side, you see how the whole skin pinches up, pinches and lifts. Here, it pinches, but it doesn't quite lift. So the middle aspect is still tethered down. So that is, I would give that a 2 out of 3. So now we have our baseline for the objective findings with the patient. And so now we want to teach the patient how to apply and how to use PT straps every day. For proper usage, we want to clean the area up, okay? If the scar is all healed up, there's no open areas, no scabbing or anything like that. So we're gonna alcohol it down really good to get all the body oils off area so that the adhesive ends really are solid. I'm going to take the PT straps to apply it. We see the little incision right through here. I'm going to tear the paper backing to give us 2 pieces. Then I'm going to peel the paper off one side, okay? And that will be put on one side of this incision. Right? So the incision is going along the line of the end, but I'm not putting it directly on the scar. That's important. So I'm going to straddle it with the other side as well. Peel the paper off. We're going to pull it around so that there's about a 1/2 centimeter to a centimeter distance between the ends of the PT straps. So that leaves the scar exposed right between the 2 pieces. Then after putting it on, you're going to rub it down really good for a good 5 to 10 seconds, just rubbing it to allow the heat to get the adhesive to really stick onto the skin, okay? Then once you have it on, I recommend not pulling on it just yet. You got to give it a good 5 to 10 minutes for the adhesive to really settle in, okay? Let's show you how to use it. So as you can see, since the 2 ends are close together, it's going to form a little hoop, okay? That hoop is going to be the patient's handle to hold on to. I recommend him to grab it at the very base of it, and he's going to go through a series of movements, okay? So basically, we're going to do circles, just small clockwise circles, just like that. You feel it? Mm-hmm. So you feel a little pull, right? Mm-hmm. But there should be nothing like that. Okay, so I recommend anywhere from 5 to 15 little rotations. Okay, and then he's going to shift and he's going to do 5 to 15 counterclockwise rotations. Okay, so after 5 to 15 counterclockwise, now I'm going to go inferior, superior, 10 to 15 times. Okay, so after 15 of those, now I'm going to do medial to lateral, 10 to 15 times. So that completes the whole sequence of the series. Now, once the patient gets comfortable and familiar with doing it, it should take very little time, a minute to a minute and a half to go through the sequence just like that. And you want to try to do that 5 to 10 times a day. Okay? And you can see it takes a minute. You can do this in front of the TV, at dinner, watching, you're on the computer, whatever. You can be doing it frequently. Okay? So that completes documenting the objective findings for the scar mobility and the ankle range of motion, educating the patient on applying it and using the mobilization technique using the PT straps.